Welcome to Evidence to Excellence, news in neuroplasticity and rehab powered by the Recovery Project. We want to personally welcome and thank you for joining us today.
Welcome back to Evidence to Excellence. It has been a long 4 months since the last time I have been here to do the next podcast. So today I thought it would be so appropriate to talk about what's going on in this world the last 4 months, talking about COVID-19 and how it relates to rehab, how it relates to our neuro population out there, and also talking about the pandemic and our experience at the Recovery Project going through this whole last 4 months, what we've learned, how we've made decisions based on our business, based on treating our patients, and what we've discovered, what we've noticed with some of our patients that, of course, did not get COVID, and we have been very fortunate that our patients have not had COVID, but how the pandemic has affected this population of people that we see here at the Recovery Project. I am here with Becky Lindemann. And Becky works for the Recovery Project, and she's the director of rehab and has been working for the company since 2005. Becky is a physical therapist, I didn't already say that, and graduated from Wayne State University right here in Detroit, Michigan. And I thought it was appropriate to have Becky join me because Becky, as the director, was kind of thrown into this position during this pandemic where quickly she had to become an expert in COVID-19, in CDC guidelines, in really looking at what the new world of outpatient rehab is going to look like with a pandemic, with the new PPE, the personal protection equipment that we now have to wear, and really making all of our procedures and policies based on the safety of the patients that we see here, and also the safety of our staff. So we were kind of both thrown into this role extremely quickly. It kind of happened, I would say, within 5 days. Yes. When all of a sudden we were like, okay, this is a different world. This was also a world that in my 35 years of being a physical therapist, of practicing physical therapy, I never would have anticipated that something like this would have happened. So it's new territory. Yes. That it wasn't something that we could go back and say, well, do you remember in 1982 when this happened before and we did A, B, and C? And it was like, no. And I think we're seeing the same type of decisions, the same type of policies, procedures being developed even throughout the country, because we don't know. We're doing our best to make everybody safe, but we are also learning as we go about COVID, yes, about a pandemic that has lasted this long and how that affects even people that don't have COVID. Right. So let's kind of dive into this conversation as we go. So let me give a little background, and I'm going to look at my notes here because we have been extremely busy during this time. And some of the dates of when all this happened, when I looked back, I was like, wow, I don't remember that. But let's talk about the COVID pandemic. It's an ongoing pandemic of the coronavirus, yes, in 2019. So that's why it's called COVID-19. And it's caused by acute respiratory distress. Now, we're going to talk a little bit about what we're discovering now is that really COVID-19, yes, it shows people experience this acute respiratory distress, but we're also seeing multiple different type of symptoms.
Yes.
As the disease.
Yeah, we will talk about that too.
Okay, so we're going to talk about that. So the outbreak was first identified in Wuhan, China in December of 2019. The World Health Organization declared the outbreak a public health emergency of international concern January 30th of 2020. And a pandemic, they said this is a pandemic, across the world on March 11th, 2020. Mm-hmm. So again, just think about how quickly that all happened. As of June 29th, the last statistics that I looked at, there were more than 7.66 million cases of COVID-19, which have been reported. in more than 188 countries and territories, resulting in more than 462,000 deaths. More than 3.64 million people have recovered, which is also awesome news. And what we're hearing is now the numbers that are recovering with COVID. Let's talk about what happened in Michigan. So for you guys that are watching this, and maybe you're in other parts of the United States, Michigan was one of the states that was hit initially very hard. We are sitting here in Livonia, Michigan right now, and we're in Wayne County. And Detroit is part of Wayne County. And we were hit probably in the top 3 in the country when it first came out, that Detroit and Wayne County was hit severely. On March 10th, our governor declared an executive order declaring that Michigan was the state of emergency. So at that point in time, we started feeling this COVID-19 pandemic coming across Michigan. We were still open full time.
We were.
And we started seeing that some of our patients were canceling. We started to hear that message that, oh my gosh, this is getting a little scary here. What do we do? And we started seeing that our patients weren't coming in, and our cancellation no-show rate was just boom growing at a very rapid rate. On March 23rd, our governor determined a stay-at-home order in Michigan. Now, between March 10th and March 23rd, we attempted to stay open. We had to lay off 85% of our employees we laid off somewhere around March 19th date. Becky and I continue to work, and we're going to talk about that in a little bit. But what we noticed is by the time the stay-at-home order came through, it was obvious that we had to close the clinics. So we closed 3 of our clinics, but Becky and I kept working, and a couple other people kept working, and we started doing telehealth, which we're going to talk about in a minute. But when the governor determined a stay-at-home order in Michigan, in that stay-at-home order, she did declare that essential employees could continue to work. Now, as a rehab center providing physical therapy, occupational therapy, speech therapy, we were considered essential under that umbrella of the governor's order.
Correct.
So let's talk about that a little bit, because that's where Becky really had to dive into what does essential mean? Are we essential? How do we define that? And what do we do? So I'm going to kind of turn that over to you and give me a little background or feedback on that.
Sure. So just to step back a little bit, we were already preparing for COVID before the stay-at-home order was activated. So for that entire month of March, we had been hearing about COVID, learning about it, staying up to date with it, because it was already a current event in February. And so we started preparing for the safety of our clients and our staff at the end of February, beginning of March, to make sure everybody was safe while we were still open. We bumped up our infection control procedures for cleaning. We had PPE available for people who needed it for support or for their comfort level. So we started getting all of that going before all of these orders started coming through. So when the order did come through, we had already been looking at, we're all learning this at the same time. And so one thing we had to do is go to our important, reliable, evidence-supported research centers, people who are experts in managing public health. And so we took all of our direction from the experts. So things that I would read on a daily basis would be our American Physical Therapy Association statements on how to manage clients as things began to evolve. The Center for Disease Control, the CDC, was continually updating, and so we stayed on top of that. The state of Michigan, the Department of Human and Health Services, also was providing guidance. So we were really focusing on what we know as healthcare professionals. As a healthcare professional, we've been dealing with infection control and managing things like this for decades and decades. So during all of this craziness, it was really important that we fell back on what we know and what we use every single day to protect ourselves, to protect our patients, and really make sure that we are being super precise on our procedures for that. And that's really what's carried us through all of this up and down and this evolution. So as far as the essential goes, when that order came down and she said essential businesses could remain open, the definition was for healthcare, we would be essential if we were necessary to prevent someone's decline as far as if care was life-threatening if they didn't receive it, or if it was going to be something that would be significantly detrimental to them on a permanent level. And you know, based on what we do and our specialty in clients who have chronic or permanent neurological diagnoses, you know, our care is definitely essential. So we were able to continue to provide care. We had to continue to provide care. It was our responsibility, even though everything closed, to figure out a way that we could provide this safely for our patients so that they didn't feel like they were at a loss. Because unfortunately, you know, as a lot of the things in our world shut down because of COVID, people don't stop having strokes or brain injuries or spinal cord injuries because there's this virus around. So it was our responsibility to make sure that people who needed the care during this environment could get it and they could get it safely.
So we ended up closing our clinics.
We did.
And it was a business decision, and I'm one of the owners, and it just didn't make sense to keep it open. So we were like, we need to close. At that same time, across the country, Medicare, other insurance companies were allowing telehealth to happen. So Becky and I were one of 3 PTs that stayed on here at the Recovery Project to start treating patients telehealth. And let me tell you, that's something I did not learn in school.
Nope.
You know, and really, we thought about, you know, we said, okay, well, we're going to do telehealth. And what was interesting is my first concern was, we're working with the neural population. So we're working with people that have had strokes, spinal cord injury, head injury, MS, Parkinson's. They have mobility issues. And we're so used to hands-on, keeping them safe, progressing them in their functional activities and their gait. And I'm like, okay, we can do this. Now, one of the things I've been practicing for a very, very long time, and so has Becky. And when we first started doing this, I'm like, we are probably the best people in the company right now to dive into this and figure it out. Just because we're creative, we've seen everything in our career, and let's see what happens. So we dove into it. And at first we probably had about 10% of our caseload that said, okay, we're gonna try telehealth. Yes. Now that grew as April came through, and I have to tell you, we're still doing telehealth. And I want Becky to add some things on this, but what I learned very, very quickly in my experience is the value that I gave to each one of my patients, and how beneficial it was for their progression. So physically, and let me tell you, mentally, and not just for my patient, but also for the spouse, the caregiver, maybe the paid attendant that was taking care of the patient and had to go into their home every day, how helpful it was to have me on the other end of that screen to answer questions, to motivate that patient to keep moving and doing what they're supposed to be doing. So let me ask you what your experience was. What did you see some of the benefits? Maybe tell me a little bit about some of the creative approaches that you used.
So I have to say I was not apprehensive, but I felt like I had to over-prepare for telehealth just because it was so different from our normal approach when we are face-to-face with a patient. But I have to tell you, after the process and after going through it, I think telehealth is an amazing way to provide care, and I'll tell you why. When I am on one side of the screen and the patient is on the other, and it is them and their caregiver, or them and their spouse, or daughter or son, whoever it is, I have no choice but to make sure, and they have no choice but to fully engage in that session independently. So it's a really good bridge to encourage people to figure out ways for them to perform their exercises or activities and take full responsibility over what that looks like at that team, versus me going in and working with that patient and then sending them home with their spouse.
Yes.
So I think the ability to really incorporate that home program through telehealth, not only do you direct the patient and the caregiver or the loved one on how to do each intervention, just the two of them, you can't, you have to have that therapist supervision and that direction. That's why they have us there. But to have them do all that hands-on together really helped with that learning experience. And a home program, as we know as therapists, is vital for a patient's progress, improvement, and their carryover. So once we've stepped out of the case, and the patient and the family or caregiver are on their own doing it, they know and they're confident that they can do that after I step back once they've had the repetition.
So one of the things that I noticed was our patients that started telehealth, not right away. So let's say, everything shut down and they decided the third week in April to start telehealth with us. And they may have been out of therapy for a month plus.
Yes.
So one of the things that I noticed is a decline, a significant decline in where that patient was functionally, their ability to walk, to transfer, their mood significantly changed from not just having that intervention. And that was really, and also I want to add the frustration of the caregiver or the attendant or the spouse of they haven't been doing anything. And I'm noticing they're tripping more, or I'm having to do more to help them move. So there was this significant decline. Tell me a little bit about maybe what you saw out there of maybe some of the decline or the lack of medical attention that some of these patients, because of the fear of even calling their doctor.
Right.
Yeah.
They were, most of the clients that we had at that point, end of March through April, everybody was locked down in their homes. So people were kind of fending for themselves for medical care. Some people may have been doing a little telehealth with their physicians, but not a lot. We had a lot of communication with case managers. So case managers are professionals who oftentimes are part of our healthcare team for our clients who have complicated medical conditions. They help guide the clients. So we were a great resource for the case managers to get these clients back up to speed and doing some form of their program. But definitely there were clients that we would get on our first session and they were so appreciative to see us. One thing I have to say about our patients they are so motivated and so dedicated to their own care and taking full advantage of what we have available to offer them, that you've now put these people in their home. They don't have a lot of interaction. They can't get out like normal. And they've lost what they feel like is their control over their diagnosis. Just that connection over telehealth and saying, hey, we're here for you, we're gonna get you back up to speed. Just that hope and that opportunity immediately helped with mood elevation, energy level, focus, motivation, that relationship between the client and the caregiver, like that team was ready to go. And then from a functional standpoint, I definitely had reports that people were feeling low energy and not as strong, and they were losing their transferability. So, we see a variety of clients. It was a variety of reports, but generally, yes, people were very concerned about losing ground with their physical function.
Yeah, and I know that I had a couple that developed wounds
Yes.
You know, two things is one is they may not have been wearing their bracing correctly, and maybe they were getting swelling, let's say, because they weren't moving as much as they used to. They were wearing their orthotic, and then they would get a wound or develop an infection, cellulitis, nothing to do with COVID, just some of the things that we see with the type of patients, and it just wasn't being managed well. They didn't know what to do, so having us on the other side of the screen and saying, let me see your wound, let me see what it looks like, and asking these questions, we then could direct them to say, I need you to call your wound doctor, I need you to call this doctor to make sure that you are getting the care, because right now it needs some intervention of whatever is going on.
Yeah.
The other thing that I notice, and this typically happens in the neuro population, is that a lot of the times we prescribe orthotics, an ankle foot orthosis, a brace for the leg. And we prescribe that because they need to wear that when they're walking. Let's say they have foot drop or something like that. So typically what I noticed happened is I'd get them on telehealth and I'd say, where's your brace? And they said, well, I'm at home. I don't need to wear it when I'm at home. What was happening, and so the caregiver's there, and I had to educate the caregiver and the patient again of the importance of wearing that brace, because now you're going to lose the range of motion of your ankle. And if you don't start using that, when you do come back to us, then we're going to have to deal with joint contractures, soft tissue contractures, which can result in multiple different problems. So again, just that having us there and that education, even though we say it when they come into the clinic all the time, the importance of wearing your brace, in their head, I'm at home. I don't need to wear that because I'm not walking like I used to.
But you do that for a long term, and then all of a sudden, the brace doesn't fit anymore. Or you try and get into that brace, and then that will develop.
Exactly. So let's change our conversation, and let's go back to COVID. So let's talk a little bit about COVID, and this may be a review for some of you out there, but let's talk a little bit about the populations that is most at risk of COVID-19, and any evidence that you found that you want to talk about.
Right. So, you know, one of the things that's interesting about COVID is the first thing we did is look at our clientele and say, okay, are our clientele at risk, high risk for COVID? So there is a defined list of risk factors. That's if someone has one or more of these issues, then they could potentially be at risk for a serious illness. First one is if someone is over the age of 65, and the risk goes up by decade. So someone who's 65, the risk is high, but not as high as someone who's 75, and then again at 85. If it is a person that lives in a nursing home or long-term care facility, that medical condition, they are quite compromised, so overall they are at higher risk for a serious illness should they contract COVID. Lung conditions. COVID, a large component of its presentation is respiratory distress. So if you already have a lung diagnosis like chronic obstructive pulmonary disease or a significant asthma diagnosis, then should you get COVID, you're at a higher risk for respiratory distress. People who have diabetes or hypertension, a cardiac history, those conditions also, when someone has the stress of COVID, if they've become positive, will possibly at a higher rate get the serious illness. Liver disease and kidney disease. So if someone is on dialysis, they are more susceptible to a high-risk illness. And lastly, immunosuppression. So people who have cancer or are actively being treated for cancer, a lot of times they have a strain on their immune system. If you've had an organ transplant, if you have an autoimmune disease and you're on immunosuppressant medications. So these people have to be extra careful when they go out in public or avoid going out in public to prevent getting COVID, because if they get it, then there is that chance that they're going to possibly end up hospitalized or worse.
So, you know, right now, statistically, 3.64 million people have recovered from COVID. And I want to kind of change this conversation over in talking about those people. So people that have recovered from COVID, what is their condition now? What's their functional level?
Right.
Is it something that we, a rehab center, PTs, OT, speech could help with?
Absolutely. So the thing with COVID, on the good side, the majority of people who get COVID are going to recover without an issue, okay? So that's one thing we always have to keep in mind. But the reason we are being so diligent about our social distancing, use of mask, and avoiding going out in public unless absolutely necessary, now that we're lifting that. But when we were doing that more diligently, the reason we were doing that was to protect the minority of people who could develop this illness. So a lot of people who do become positive for COVID will be able to recover on their own just by healing and getting more active and doing things. The people that we are most concerned about as rehab specialists are those that are hospitalized and can develop a cascade of additional complications. So as rehab therapists, we are not necessarily going to treat the COVID condition, but if you get COVID, and you can develop multiple other impairments. So I got my list here. The thing with COVID is, first, it is a respiratory condition, we know that, and what I'm sharing with you is specifically what we learned from the CDC and the research studies. The serious conditions include acute respiratory distress. ARDS is a diagnosis that you can get with multiple types of respiratory illness. So that is something that rehab specialists will treat after someone's been hospitalized, discharged, and then gone home or to a rehab facility. The decline in respiratory function will affect their endurance level, how long someone can walk, can they even get out of bed. So it's really important for clients that are trying to get home or are home but significantly impaired to get that therapist involved in their care to work on their respiratory fitness. Here we have a whole program to support respiratory health. Another condition that they found and tracked with COVID are neurological symptoms. And so COVID can affect the parts of the brain that are responsible for your respiratory centers. So not only can your lungs be affected by COVID, but the centers in your brain that control and keep your breathing maintained, those can be infected as well. And so you're dealing with a neurological condition. It has been known to cause acute cerebral impairment, so people have had stroke from COVID first. It can cause muscle wasting and muscle damage, and it can cause peripheral nerve damage, so that can cause pain. One of the list of the symptoms of COVID is loss of taste and smell. So there are different neurological effects that COVID can cause, not just the difficulty breathing and the flu-like symptoms. So as rehab specialists, that is what we do. We treat those things, and exercise dosage to get someone back from a debilitated state like that is crucial. So coming to a therapist and having someone guide them safely through not only a safe exercise program, but an exercise program that's sufficient enough to make change is so important.
Right. I read an article on HAD, which is hospital-associated deconditioning, and they're starting to look at do they make that an ICD-10 code? So this is this coding that hospitals and we would use to treat somebody, because what they're seeing is that these patients that have had to be hospitalized with COVID are hospitalized, especially initially in the earlier, in March and April, when especially our area was so prominent that they were in the hospital for a very, very long time. And when they're finally discharged, they have this hospital-associated deconditioning. And like you said, they are just so fatigued, and for them to go back to their home and living that functional life, that quality of life that was so important to them, it's crucial that they get involved with a rehab center to get them back, and for us to be able to prescribe the appropriate dosage and to challenge them so that we can get the strength back and the endurance back, and at the same time work on their respiratory system to build that back. So there is so much interesting information coming out, just the effects of a long-term hospitalization, And think about that, including isolation.
Right.
You know, and I don't have the date on this, but in the last month here in Michigan, the governor just lifted that people in the hospital could be visited by their loved ones. There was a very months where people, if they did have COVID, their family couldn't even go in and visit them.
Correct.
And I know that the nurses who are been awesome through this, you know, would have an iPad that you could zoom in and see your loved one, but you know, just that isolation and that loneliness and how that affects the mindset of trying to get better during this terrible time. So we kind of already talked about this, but you know, the importance of therapy with COVID. But let's talk a little bit about the pandemic.
Sure.
So there are millions and millions and billions of people out there who across the United States have been affected by a stay-at-home order. Thank goodness did not contract COVID, but now they're at the stay-at-home order. And I really want to talk about more of the geriatric population, or the people that maybe don't have a lot of family, maybe their family's in a different state and they've just been relocated, but now that they have to stay home, so they're not interacting with others. And then this population that is at high risk, which would be my parents, you know, people's grandparents that are now home alone, and we are trying to protect them and saying, I'm not going to come visit you. I don't want you to go to the grocery store. We're going to take care of all that, and you just have to stay in your house. So what I have been reading is just the effect of the pandemic on this population of people, of the effects of isolation, the effects of being lonely. Now, one of the things that you hear on TV and you keep hearing about, just Zoom your parents. Let's all get on. How many people have done a Zoom meeting, all that kind of stuff, do this? All of us have, right? And trying to set that up with your parents. And I can tell you, some of my parents really didn't have that technical background. Some people don't even have the equipment, you know, the technology to go ahead and do a Zoom meeting, and that's a learning curve that itself. You know, and there's some statistics out there that are starting to come out because of the length of this pandemic of what isolation and loneliness does to people. So depression, you know, increased suicide is what we're seeing because of that as well. This increase of anxiety disorders. And I have to say personally, when we first were stay-at-home ordered and isolated, there was definitely some anxiety in my part as well because of this unknown, and I had to turn off the TV, I have to tell you, because it was giving me a little anxiety to constantly be turning it on, and the only thing that people talked about was how bad this was getting. Now, important information, but it gave me a little bit of anxiety. And we're seeing now this long-term effect, symptoms. Now, we know that depression can physically affect strength, endurance, can affect people's risk for falling. So all of this can happen. And also this overall deconditioning, you know, it has been stressed during the pandemic to get outside. And to get outside, and you need to go outside and get some fresh air and walk, let's say. But then there was this mixed messages. Do we wear a mask? Do we not wear a mask? So some of our older people are out there walking, but then they're wearing a mask, and is that really the best thing? You know, and we know this, that it's not. If you're social distance, that if you're outside and exercising, you really should take your mask off.
Yes, and you know, there are a variety of comfort levels in the population. But if you're by yourself, outside, if you're gonna do active exercise, which would mean bringing up your heart rate, bringing up your respiratory rate, and you are by yourself, it would be safer to do that without a mask on.
And I hope that that's changing as we get through this, and some of the governor's orders, at least here in Michigan, I can talk about, are starting to lift. We are seeing more and more people going outside and exercising, and I am, you know, hopefully seeing that these these individuals that were so isolated that hopefully we're starting to see some of this interaction to help them. Like, let's get back at some level, whatever that looks like, because we're still in the unknown phase, but whatever that looks like to get people moving. And if anybody out there has family that, you know, you finally are in the house and you're noticing this deconditioning, we are, you know, rehab anywhere, you know, it would be so important for them to get back involved. If it's telehealth, if it's going to a clinic, if it's bringing people in the home to get people moving again.
Yeah, it's important to have that connection. And, you know, if someone is depressed, we can't necessarily treat the depression, but we can treat the physical impairments. So the loss of function, the change in function, that is what we would define as therapists, and we would address that. But we also know through research that if someone has a confounding factor of depression, if we're doing physical exercise and addressing physical components, that will have a positive influence on someone's depressive mood. So there's research out there that walking for 30 minutes outside can have an improvement on someone's depressive symptoms.
You know, I want to add to that, and it's not just physical, because just exercise also affects memory, cognition, and some of those things that it being isolated can cause a decline on.
And the nice thing that's happened since the quarantine that we've experienced in Michigan and other places in the U.S. is that there's a lot of opportunity for virtual exercise.
Yeah.
So there are free classes out there for people to take online. You know, you can do things through your gym. There are a variety of ways.
Right.
So if there's a way for someone, if you know someone who's, you know, had a hard time with this quarantine, whether they've been anxious or upset about it, or, you know, any change in, you know, a normal mood, just trying to get a little bit of exercise in. And now that the weather's nice, at least here in Michigan,
right.
I think it's made a big difference for.
So my last question is, I want to talk specifically about the neural population.
Sure.
You know, we are here, I can say here, we are in the process of, our patients are coming back into therapy. And I would have to say we're at about 80% before the pandemic of people coming back, but not everybody, because there's still a fear of coming back to rehab, and an unknown of the telehealth, even to get involved in that. And I wanted to ask you, and I'm going to ask you like a per diagnosis of some of the medical groups that we see, the effects of, and this has nothing to do with COVID, but just the effects of if you need therapy, rehab, and you're not getting it because of the fear or the unknown of not being involved even in telehealth, how can that affect the recovery?
Right.
So first, TBI, brain injury.
Yes. So, you know, TBI, as we both know, TBI could mean a number of impairments for someone who has a traumatic brain injury. But generally speaking, some of the things, if I heard that I was going to get a client coming out of telehealth who is dealing with a traumatic brain injury, the first thing I would think of is, you know, participation. When we bring them in for telehealth, are we going to check with them and see what kind of activities they're doing at home based on what they were doing before? Are they able to maintain some of their routine? If they've lost their routine, a lot of times clients with brain injury who have cognitive changes or emotional changes, that routine is essential for their balance, their emotional balance in life, mental balance in life. So if they've lost all that, trying to get to them with telehealth is very important to get some of that routine back and get that external skilled support to help ground them with that activity. That's number one. Another thing with brain injury, with the physical impairments, would be if someone has spasticity issues or paralysis issues, you know, making sure they're not losing range of motion. So if they are not getting their stretching in or their exercise in that they were getting in with regular therapy, making sure that they, and if they have caregivers, are trained in how to do that at home and monitoring that and progressing that. A lot of times with our brain injured clients, if they have a staff of caregivers, it takes consistent use of telehealth to get to each of those caregivers. We want to make sure that that range of motion and those activities that they're doing are not only effective and safe, they have to be effective and safe. So
yeah, one of the things I want to add is we always talk about neuroplasticity in this podcast, and one of the things with any incident with the brain, if it's traumatic brain injury, stroke, MS, is the importance of repetitions.
Right.
And so patients that are coming in, they usually are not doing the repetitions at home that are needed, which could be via walking, which could be dressing themselves, which could be working on feeding, whatever that is. And maybe now that they're home, the caregiver's doing it for them. They're not getting those repetitions, which will affect their motor return if they had any paralysis.
Right.
Yeah. So what about spinal cord injury?
So for spinal cord injury, we are looking at things, depending on the level of the injury, number one is respiratory health. So the good thing that has come out, and they're still doing research with the COVID, is just because someone has a neuro condition doesn't mean they're at higher risk for serious illness with COVID. It's all those specific ones.
Yeah.
But for someone who has spinal cord injury, if they have a compromised respiratory system, so they don't have the muscle function to be able to fill their lungs like normal, they don't have that abdominal control, if they've had paralysis in their diaphragm, first thing we want to do is make sure they're doing respiratory exercises. We're teaching them breathing exercises. We're making sure that they have the range of motion they need in their thoracic cavity, so like through the ribs and the shoulders and the chest and the back. We want to make sure that they're doing activities that help with that. Managing paralysis and spasticity in the legs, so getting that range of motion in. If they've been doing strengthening, we're going to make sure that they're doing all those exercises. We've even incorporated some functional electrical stimulation.
Yeah. You know, one thing I want to add, and during the pandemic, I've even had some patients that their equipment broke down.
Correct.
They needed a new wheelchair during this time, and we have used telehealth, that we have worked with a DME rep, we worked with the patient through telehealth, and we ordered them the DME equipment that was needed, because remember, in a spinal cord injury, their legs is their chair. So if that breaks down, you have to make sure that, so we have even done that. So there's important to even look at equipment. What about MS?
So with MS, we want to focus on endurance and balance. And, you know, of course with MS, there's a variety of impairments again, because it's all central nervous system. But the first thing I would think of is, if someone's walking, looking at what their balance looks like. Is their endurance, are they walking as long as they used to? And what can we do to work on making sure they're maintaining that at home?
Right. You know, and you know, if you know, with MS, with some forms of MS, they get exacerbations and then recovery. So that would be really scary of a patient with MS. Let's say they had an exacerbation during the pandemic, and the importance of really reaching out to one of your physical therapists wherever you are to get an assessment, maybe get an update on what you can do now if you are not comfortable coming into the clinic.
Right.
Kind of talked about stroke already, and do you have anything to add on if somebody with a stroke is not getting service?
I would say if someone has had an acute stroke, having it now and not getting the rehab you need would put someone at a real loss.
Yeah.
You know, we know with neuroplasticity that no matter when your diagnosis was, you can make some improvement. But if you're dealing with a new stroke, it is so important to take advantage of this special window of 6 months to a year to really try and get as much function back as you possibly can. And I think telehealth has been a great way to do that. We've seen clients with new stroke on telehealth, and you know, them partnered with loved ones or just on their own have been able to do a lot. You know, when we see patients in therapy, we're seeing them, you know, 1, 2, 3, 5 hours a week, sometimes a little more, but not always. And you know, that helps, and it's our job to guide them. But so much of recovery not only has to do with when you're in the clinic, but what you take from the clinic and do at home.
Exactly.
And you can still do that with telehealth.
Right. Agreed. Finally, last diagnosis, Parkinson's disease.
Yes. So I think the best thing that we know about Parkinson's disease is there's so much research that says that exercise can positively influence the type of progression you're seeing with your condition. So if you're exercising at the right frequency and the right intensity, that they have recorded that the progression will slow down. So to go into a quarantine and to stop that essential care that's really influencing and improving your condition, we have to make that accessible. Like, we can't accept that. So telehealth, I had a couple Parkinson's clients through telehealth, and they did so well.
Yeah.
Improved function, improved bed mobility. We have such effective exercises for Parkinson's that you can see a night and day change at the end of a session.
Yeah. And I want to say, you know, in this world, I mean, that's one of our centers of excellence is Parkinson's, and you know, we here have an enormous wellness program.
Yes.
Now, we have so many patients that are involved in our rock steady boxing classes and yoga and our power classes, and again, that all stopped when this all started, and it's not back yet because we feel it is not yet safe and that we can appropriately social distance and bring people into exercise. But what we have learned, and one of the things that we are doing, is that first of all, out there, if you're not from Michigan, wherever you are, look at your Parkinson's Foundation of your state. So many of the organizations are putting up free classes that you can tap right into virtually, and you can go ahead and participate in a class. Now, Rock Steady Boxing, which is that boxing class for Parkinson's, which is high intensity. If you haven't seen it, check it out. I mean, I don't even know if I could do a class, but it meets all of those important elements that we know is just as effective as the medicine. Need to do both, but just as effective as taking your medication with Parkinson's disease. That we're going to be starting our virtual Rock Steady Boxing classes. I think our first one is July 1st, next Wednesday, and we are offering, they're going to be free for the next couple months. So, I mean, if you can check on our website. I'm not here to promote that, but the importance is that there are some free things out there that I think the healthcare community that is working with Parkinson's are really looking at how can we provide care, services, programs for people with Parkinson's, because they are at that higher risk that Becky talked about, that how can we provide this care so that they can slow down the progression of the disease, stay mobile, decrease the risk of falling.
Right.
So we're really looking at doing that. So I want to thank you for everything that you've done during this, and just the wealth of knowledge that you have, and I appreciate it. Is there anything else you want to add before we end our session?
I just think it's important, no matter what trials we go through as a community, is that everybody continues to put health first. I think, you know, keeping up with your fitness, keeping up with your exercise, no matter what we're dealing with, we know has positive effects. It has protective effects, it has rehabilitative effects. So if anyone out there is struggling with anything about what's going on now or in the future, like, see a rehab specialist, see your doctor, talk to people about it, make sure you're getting the support you need. It's out there. The healthcare field will always adapt and always make sure that we're just doing our best to make sure everybody's getting what they need.
Excellent. Well, thank you, everybody, and we'll see you next time.
Thank you for listening to today's Evidence to Excellence News in Neuroplasticity and Rehab podcast. We appreciate you and hope that you come back every fourth Tuesday of the month to get more of what's new in evidence and research in the neuro rehabilitation world. To learn more about the Recovery Project or to find out what we're up to next, you can visit us anytime at therecoveryproject.net.